Let me know your name and your current position.
Dr. Helen Croker, and I'm the Assistant Director of Research and Policy at World Cancer Research Fund International. So World Cancer Research Fund is a network of charities. So we have charities in the United States, Netherlands and UK, and a presence in Hong Kong. And we are championing research in diet, nutrition, physical activity, body weight, in relation to cancer prevention, but also survival after cancer diagnosis.
How frequently do these kinds of studies come out from the fund?
These particular reports this isn't primary research, so these are bringing together the global evidence for the role of nutrition, physical activity and body weight after diagnosis of breast cancer and colorectal cancer. So they're bringing together the findings from very extensive systematic reviews with judgment of the strength of that evidence by our independent expert panel, and then bringing that together with expert opinion to create practical recommendations and guidance for people living with them beyond those cancers and the health professionals that care for them.
So why did you decide to unveil this at the Congress?
Well, it's really the perfect place to launch these. You've got all of the key stakeholders, organisations, but also there's people here attending who themselves are living with them beyond cancer. So to have the opportunity to launch these at the World Cancer Congress is a real honour to have such a great audience for them. For both breast cancer and colorectal cancer, the reason that we've started with those, because we're obviously interested in the health after diagnosis of all cancers, but for these cancers in particular, we started with because they're some of the most common cancers, but they're also the cancers where diet and nutrition, physical activity play a really great role. So starting with these cancers where there's the kind of likely to be the largest amount of evidence, we hope that we've got more to say from the evidence, but also there's a kind of great number of people to reach. But that isn't to say that other cancers are not important, of course, all are.
Let's start with breast cancer. Why did you choose to go this route?
Breast cancer is the most common cancer in women and second most common cancer globally. So it's clearly a really important cancer to focus on. Survival rates after cancer, although variable according to region, is improving, which is great. We have improved treatments and improved screening now. With improved survival becomes the potential for really improving health long term after a diagnosis, which is why it's really important to understand what impact these risk factors can have on people's long term health, so we can really maximise people's health and quality of life in the longer term. So breast cancer is a kind of obvious cancer to start with, because we know, for example, that obesity is a major risk factor for developing cancer. So the question is, could these same exposures be important for improving long-term survival after diagnosis?
What was different with your approach in this study?
So many people undertake systematic reviews, of course. Systematic reviews are really critical in this area. So you take the totality of the evidence and really understand, bringing it all together. What's the picture across the board internationally? What we do with the CUP Global programme at World Cancer Research Fund is take the findings from the systematic reviews and really take it a step further. So not just to understand, what are the associations that you see between particular risk factors and outcome, but actually thinking about what do those associations mean? Are they causal associations, for example? Can you directly attribute the effect of an exposure on an outcome, or are there some other confounding factors, for example? So our panel really critiques all of the evidence, the quality of the studies, the sort of characteristics of the participants in the studies, to really understand what those associations, but also look at the mechanisms underpinning associations, so they can really make sense of what it means. So I think in terms of what's different, it's really extending a traditional systematic review, but moving it kind of further on.
When we talk about systematic reviews, one issue that I personally often have would be the scope of the period that this data covers. As a scientist, I know where this is coming from, but for me as a person, as a journalist, we want something newsy, like data set that is more recent. But most of our systematic reviews are often from probably 2 years or 3 years ago, so we may struggle to have a clearer, truer picture of that. Are you concerned about that, about systematic reviews? Do you still think insights from these systems can still give us a perception of what the current state of the issue we are studying looks like?
I mean, it's a great question. There's always a lag time between a study being published and them being in systematic reviews. And in fact, with cancer research, when we're interested in looking at the impact of lifestyle factors on either the chances of developing a cancer or surviving after a cancer, you've in fact got very long lag times because it takes time for those factors to have an impact. So you might be looking at years. So already you've got lag times. But really, when you're looking at the sort of totality of the evidence, we go from inception of the scientific databases right up to the point of the search dates. So we're typically including nearly all of the recent evidence there, but of course there's always new studies coming out. But I think because we're looking at all of the research and judging that, oftentimes one or two new studies isn't necessarily going to make a big picture when you're looking at the full picture of the evidence. But in the long term, it's really important that you can keep monitoring new research, and we're setting up a system for doing this through a data prioritization process where we can keep abreast of what's coming out, and is that going to make a difference to what we've already found? So therefore, do we need to kind of look down in more detail at those studies?
What did you find in this study that wasn't conventional, that wasn't something we could have expected?
I mean, I think one of the key learnings from this for breast cancer, well, there's actually, as you'd imagine, an amount of research on breast cancer. However, there's few RCTs specifically looking at the impact of lifestyle exposures after a diagnosis of breast cancer. Very few. So largely we were having to rely on cohort studies, and they are informative, of course, but they have their limitations. So what we found is that for many of the exposures we're interested in related to diet and physical activity, there actually wasn't very much research out there. There's quite a lot of research on body weight, and we see strong associations between level of overweight and, for example, survival in the long term. But it was really very difficult for our expert panel to interpret what these findings mean because of, I've already mentioned confounding, the patient characteristics not being well reported, for example, staging or the treatments people have had. So it makes it very difficult to interpret the evidence. So I don't think we've got kind of dramatic, unexpected findings, but what we're able to do is say particular behaviours that we suggest that people consider doing in order to try and improve their health in the long term. But I think what's really critical that we've done is make very specific recommendations for future research, so we can actually direct how research is done going forward to not just generate more research, but better quality research that actually enables us to answer the questions we want to answer, and also that patients want the answers to, and health professionals. Because ultimately, after a diagnosis of cancer, when people have got through the treatment, oftentimes people want to know, what can I do in order to improve my health in the long term? And at the moment, the research is not really good enough to be able to really confidently answer that question. So we provide some guidance from the work we've done here, but actually there are things that the research community can do in order to try and fill those gaps, and so we can have more confidence in what we're recommending.
Let's talk about the results.
So the guidance and recommendations that we're making in these reports, firstly in relation to physical activity, and for this actual exposure for quality of life outcomes, there was a lot of RCT evidence here, and our panel judged the evidence to be strong, so they found it convincing. So strong evidence that increasing physical activity after a diagnosis of breast cancer improves health-related quality of life, and more limited evidence, but some evidence of improved health outcomes. So we're able to make a strong recommendation for women after a breast cancer diagnosis to increase their level of physical activity in order to improve health in the longer term. In relation to the dietary outcomes, we had limited evidence, but some that increased levels of dietary fibre was associated with better health outcomes. Some limited evidence for soy foods, but not strong enough for us to be able to give advice to increase soya intake, but certainly there's no indication that soy was harmful. So for people already consuming soy foods, we're not recommending that they need to stop. So I think that's quite reassuring for people, because there's been a lot of concern over soy foods. but that's certainly not what we saw in this work. And we're also suggesting if people don't, or for people to avoid gaining weight if they can, because that seemed to be associated with worse outcomes.
When we have reports like yours that are based on systematic reviews, the integrity of the papers that you are compiling, you are combing through really truly matters, so that your reports that are expected to be used for advocacy purposes would be reliable. So what I've experienced pulling this data together to ensure that the cancer research sector still maintains that reliability and trust?
Yeah, I mean, it's a really good question, and I think that the session on the research integrity yesterday was pretty alarming to say the least, and it's something that really should concern all of us. The idea that you've got sloppy research at best, but falsified research, I think, is a really troublesome situation for us to be in. And for an organisation that is evidence-based and interested in, pooling the evidence in order to provide the best information for the public, it's a real worry for us. We collaborate with great institutions who do our systematic reviews. So, for example, our research team at Imperial College London, who do a lot of our systematic reviews. So we're in discussion with them, obviously, about how we can, manage this and really kind of think about this. In terms of the kind of funding from, where research is funded from and kind of industry funding, those are data that are extracted as part of the review process. So when our panel are judging the evidence, they know studies where there is industry funding. So it's not that we discount that research, of course, but the panel is very aware of where the funding sources are. Yeah, so we're able at least to kind of know where research is funded.
Building on that, these recommendations, are they global in nature or are they regional in nature?
Yeah, that's another really great question. So obviously, as a systematic reviews, we're including global data, so we include all studies. So, and we have, representation from, across the world in the data we're looking at. However, unfortunately, currently, there is a big skew in where the research is carried out. So much of the data is from high-income countries, much of it's from Europe, United States, some from China. I mean, of course, other countries as well, but predominantly for these reviews, probably won't surprise you to hear that the data is skewed. So for us as a network of charities, we fund research globally, and we are actively trying to support and encourage applications for funding from low and middle income countries, and we have some initiatives in place to try and support research coming from those areas, because only through funding research in underrepresented regions can that research eventually trickle through to, for example, the systematic reviews that we're doing in CUP Global. So yes, we look at the global evidence, but yes, currently it's skewed in where the research is carried out.
What are your expected outcomes from this report that you just published? So what do you hope comes out of this report?
So these reports are really, we hope, a springboard. So these are themselves for anybody. So health professionals, policymakers, scientists, people themselves living with and beyond cancer. But these are not specifically written for those groups. So the idea is that these will form the basis of more public-facing outputs. So, and those will be written in a way that is really kind of more meaningful for people themselves, but also can be adapted according to, where people are, the communities people are, living in. So we hope that these will form the basis of health professionals being able to provide evidence-based information that they can be really confident in for their patients. But also, obviously, we continue to advocate in the policy arena to try and, have more comprehensive cancer plans across the whole treatment journey, so people can actually access the best information.
Thank you very much. So any last remarks for me?
Well, I think this work it's been very challenging for us as a network, because ideally we want to be able to make very strong recommendations for people, much like our cancer prevention recommendations. And that was the aspiration when we started this work. The fact that the evidence base currently is not strong enough to be able to do that has been challenging, and it's forced us to really step back and look at what we're doing and what we want to communicate to people. So I think the sort of processes that we've developed by working with the experts and users has been great in terms of being able to make the most of the evidence we have currently to give the best advice that's possible at the moment, being mindful that there are limitations currently in the evidence.
Yeah, that was really good. Thank you very much. Thank you. I really enjoyed that.
Thank you.